Hello, I'm Dr Shagufta working at Health and Hijama Clinic, Banaswadi, Bangalore. Today's video about sciatica. What is sciatic pain? What are the causes, symptoms, risk factors and treatment options? Watch the entire video to see the best treatment option available for this to give you long-term relief with your sciatic pain. What is sciatica? Sciatica, also called lumbar radiculopathy, is a pain that originates along your sciatic nerve. This nerve extends from the back of your pelvis down the back of your thighs. Your sciatic nerve is the main nerve in your leg. It is also the largest nerve in your entire body. How is sciatica diagnosed? Along with a complete medical history and physical exam, tests for sciatica may include 1. X-ray, 2. MRI and 3. Electromyography and nerve conduction study, EMG and NCS. A procedure done together to record and analyze electrical impulses in your muscles. During the EMG, thin needles are placed in your muscle to record electrical activity. The NCS is often done along with the EMG to determine if the nerve is working normally. Electrodes are then placed in various locations of your skin. When stimulating the nerve at various places, your doctor can then determine the specific site of your injury. What causes sciatica? Usually, sciatica is caused by a herniated or bulging disc in your spine that presses on your sciatic nerve. Other reasons for pressure on your sciatic nerve may include 1. Obesity, 2. Poor posture, 3. Tumor, 4. Abscess, 5. Blood clot, 6. Awkward sitting position, 7. Any nerve disorders. Sometimes the cause for your sciatica cannot be identified. What are the symptoms of sciatica? Most common symptoms of sciatica include 1. Lower back pain that radiates or spreads down your buttock and the back of one thigh. 2. Pain that extends from your buttock down to your foot. 3. Numbness in severe cases. 4. Weakness in severe cases. The symptoms of sciatica may look like other conditions or medical problems. Always see your doctor for a diagnosis. What are the complications of sciatica? Because sciatica is caused by pressure on a nerve in your spine, complications may develop if the pressure is not relieved. Possible complications of unrelieved nerve compression include 1. Increased pain, 2. A slipped or herniated disc, 3. Loss of feeling or weakness in your affected leg, 4. Loss of bowel or bladder function, 5. Permanent nerve damage. When should I see a doctor? Meet your doctor if your pain gets worse or you lose feeling in your affected leg or you notice weakness in your leg, or if you develop problems with your bowels or bladder, and also if your pain returns after successful treatment of your sciatica. What is the treatment for sciatica? Sciatica usually heals on its own with rest and time. To help relieve the pain, treatment may include 1. Non-steroidal anti-inflammatory medications, NSAIDs such as ibuprofen, 2. Heat or cold applied to the sore muscles, 3. Movement. Keeping your body in motion minimizes inflammation. 4. Osteopathic manipulation. 5. Surgery to repair your herniated disc if condition persists. Cupping therapy to relieve sciatic pain, does it really work? Yes. In fact, one of the best treatment options is Hijama or cupping therapy. Cupping therapy helps relieve sciatica by reducing pressure on the sciatic nerve. The suction from the cups can help to release tension and decrease the pressure felt by the patient. And also, cupping therapy can improve blood circulation in the affected area, which can help reduce inflammation and promote healing. Hijama has found to be very effective in relieving pain due to sciatica without causing any adverse side effects. While yoga and physical therapy can help to some extent, giving you short-term relief, Hijama has actually proven to give long-term relief with very good results where pain becomes almost negligible. Surgery. Around 80 to 90% of people with sciatica will not require surgery. However, surgery may be an option if symptoms have not responded to other treatments. Surgical options for sciatica include lumbar laminectomy and discectomy, Lumbar laminectomy is the partial or complete removal of the lamina, which is a part of the vertebrae, from the lumbar spine in order to relieve compression on the spinal nerves. Discectomy is the partial or entire removal of the herniated disc. Depending on the cause of sciatica, a surgeon will go over the risks and benefits of surgery and will be able to suggest a suitable surgical option. Now let's look at few very important FAQs which I'm sure most of the patients who are suffering with sciatica will have. 1. Why is my sciatica not going away? Sciatica that lasts more than 3 months or that goes away and comes back may be chronic. Chronic sciatica is a long-term condition that can cause ongoing pain. It is more difficult to treat than acute, which is a short-term sciatica, but several remedies can offer relief. The most common cause is a herniated disc in the lower spine. Another risk factor is spinal stenosis, which causes the spinal column to narrow. Will my sciatica come back? Sciatica can and does come back, especially when a person has a chronic medical condition. People who do not make lifestyle changes to prevent more sciatic pain may also redevelop symptoms. However, for most people, sciatica heals on its own within a month or 2. What are the common causes of sciatica? Sciatica is a common cause of pain in the buttocks. Sciatica is not a condition in itself, but rather a symptom of various conditions. Sciatica can occur due to a condition that is known as piriformis syndrome. The piriformis is a muscle that starts in a person's lower back and runs down to the thigh. When a person injures or overworks the piriformis muscle, it can press on the sciatic nerve. The sciatic nerve runs down from the lower spine through to the buttocks and the back of the thigh. The pressure of the muscle on the sciatic nerve causes the pain known as sciatica. Sciatica pain may be accompanied by numbness or tingling or may worsen if someone runs, sits or goes upstairs. A herniated disc can also cause sciatica. Similarly, sciatica occurs when parts of the spine narrow and begin to press on the sciatic nerve. Sciatica happens more often in people in their 40s and 50s as aging makes conditions such as piriformis syndromes more likely. Is buttock pain a reason to be worried? Making an appointment with your doctor can be helpful if there is no obvious cause for the pain and it does not subside, intensifies, or there are other symptoms. Though not concerning normally, people should still monitor the pain and it does not go away or additional symptoms occur. It is a good idea to make an appointment to see a doctor. How is sciatica treated and is there a cure? Treating sciatica usually involves trying to decrease pain and increase mobility. Many treatments are things that you can do yourself. There are several treatment options if you have sciatica that don't go away or is more severe. Surgery might be an option if your case is severe or other treatments don't help. Self-treatment, depending on the cause, milder cases of sciatica usually get better with self-treatment. Note, pain that's moderate to severe with numbness and tingling or muscle weakness are all symptoms that you need professional medical care. You shouldn't try to self-treat them. Self-treatments can include 1. Ice. Cold or ice packs can help reduce the pain and swelling during the first few days after sciatic pain starts. You can use an ice pack for 20 minutes at a time several times a day. 2. Heat. After the first several days of using cold or ice, switch to heating pad or warm compresses. Apply heat to 20 minutes at a time. 3. Over-the-counter medications such as NSAIDs are usually the first choice. They reduce pain, swelling and inflammation. 4. Stretching and activity. Learn how to stretch properly from an instructor who is experienced with low back pain can be of major help. They may also be able to help you work your way up to other general strengthening, core muscle strengthening and aerobic exercises. If the self-care treatment approach doesn't help after a few weeks, you should talk to your doctor. That's it for this video. I hope it was informative and helpful. Do like, share and subscribe and be happy and healthy until my next video. Bye-bye.